The cardiovascular, or circulatory, system supplies the body with blood. It consists of the heart, arteries, veins, and capillaries. CVD is now the most common cause of death worldwide. However, there are many ways to reduce the risk of developing these conditions. There are also many treatment options available if they occur. The treatment, symptoms, and prevention of the conditions that are part of CVD often overlap. In this article, we look at the different types of CVD, their symptoms and causes, and how to prevent and treat them. Types. Share on Pinterest. There are many types of CVD. CVD comprises many different types of condition. Some of these might develop at the same time or lead to other conditions or diseases within the group. Diseases and conditions that affect the heart include angina, a type of chest pain that occurs due to decreased blood flow into the heart. Arrhythmia, or an irregular heartbeat or heart rhythm. Congenital heart disease, in which a problem with heart function or structure is present from birth. Coronary artery disease, which affects the arteries that feed the heart muscle. Heart attack, or a sudden blockage to the heart's blood flow and oxygen supply. Heart failure, wherein the heart cannot contract or relax normally. Dilated cardiomyopathy, a type of heart failure, in which the heart gets larger and cannot pump blood efficiently. Hypertrophic cardiomyopathy, in which the heart muscle walls thicken and problems with relaxation of the muscle, blood flow, and electrical instability develop. Mitral regurgitation, in which blood leaks back through the mitral valve of the heart during contractions. Mitral valve prolapse, in which part of the mitral valve bulges into the left atrium of the heart while it contracts, causing mitral regurgitation. Pulmonary stenosis, in which a narrowing of the pulmonary artery reduces blood flow from the right ventricle pumping chamber to the lungs, to the pulmonary artery, blood vessel that carries deoxygenated blood to the lungs. Aortic stenosis, a narrowing of the heart valve that can cause blockage to blood flow leaving the heart. Atrial fibrillation, an irregular rhythm that can increase the risk of stroke or rheumatic heart disease, a complication of strep throat that causes inflammation in the heart and which can affect the function of heart valves. Radiation heart disease, wherein radiation to the chest can lead to damage to the heart valves and blood vessels. Vascular diseases affect the arteries, veins, or capillaries throughout the body and around the heart. They include peripheral artery disease, which causes arteries to become narrow and reduces blood flow to the limbs. Aneurysm, a bulge or enlargement in an artery that can rupture and bleed. Atherosclerosis, in which plaque forms along the walls of blood vessels, narrowing them and restricting the flow of oxygen-rich blood. Renal artery disease, which affects the flow of blood to and from the kidneys and can lead to high blood pressure. Raynaud's disease, which causes arteries to spasm and temporarily restrict blood flow. Peripheral venous disease, or general damage in the veins that transport blood from the feet and arms back to the heart, which causes leg swelling. And varicose veins. Ischemic stroke, in which a blood clot moves to the brain and causes damage. Venous blood clots, which can break loose and become dangerous if they travel to the pulmonary artery. Blood clotting disorders, in which blood clots form too quickly or not quickly enough and lead to excessive bleeding. Or Clottingberger's disease, which leads to blood clots and inflammation, often in the legs, and which may result in gangrene. It is possible to manage some health conditions within CVD by making lifestyle changes, but some conditions may be life-threatening and require emergency surgery. If you like the video, kindly subscribe in this channel. Baby time FYI. Thank you.